Sure, I get it. You're only 16 with an amazing immune system, and you definitely think you are not going to die from this coronavirus. However, when you visit your 80-year-old grandmother and she gets the disease and dies because of your poor quarantine habits, don't blame the virus, blame yourself. Today I'm going to tell you why you need to social distance and follow Governor Cooper's stay-at-home order. Right now I am at home with my family. My father actually has cancer and is undergoing treatments for chemotherapy. As you probably know, chemotherapy weakens one's immune system greatly. Therefore, for his health's sake, my brother and I have been researching a great deal on the topic of safety, prevention, and spread of the coronavirus. We've read numerous articles. The news has been on seemingly 24/7 in the Beringer household, and I have heeded my uncle's advice as he is the director of pharmacy at Atrium Health. Because of these things, I consider myself quite acquainted with the risks of the virus and know how to decrease said risks. I understand you may not be at risk for COVID-19. Most of us young people have much better immune systems than the elderly and immunocompromised. However, we must still take into account these individuals because they are the ones that can be affected the most. The continuance of our normal day-to-day lives are at risk, not to mention the lives of actual human beings. Disobeying the stay-home order and social distancing policies issued by the North Carolina government will not only negatively affect you, but will negatively affect your community and the world as you know it. Let's talk about why COVID-19 will affect young, non-immunocompromised people, even if you probably won't die from the disease. Disobeying the order will likely not kill the young or healthy, but will make the situation far worse by extending the order. Disobeying this decree will effectively make quarantine longer, according to MassLive.com Solus 2020, which will make it longer before we can continue our normal lives, and in some cases make the wait much more expensive. Going out and mingling with your community and friends will extend the order because reduction in travel has in fact been proven to work. Disobeying increases the chance of spread, according to nypost.com, Hogan 2020. We could see in New York City as of late that staying home does indeed to work as a deterrent to spread, as the number of cases has in fact started to level off. But you must social distance, per nytimes.com, Glenn's 2020. Therefore, other countries and states must follow suit in order to stifle this disease and let life resume normality. A way of disobeying the order will make economic situations worse. Despite having the government's hardest attempts to boost the economy with a stimulus check, is the fact that it will increase the time at which we are in quarantine, as stated previously. This will effectively make it longer before people can go back to work and make money. The stimulus check, as aforementioned, of $1,200 will not be enough for individuals, according to CBNC.com, Conish 2020. A survey by SimplyWise.com, Fleeter 2020, states that 63% of United States citizens will need another check within 3 months of getting their first stimulus check. Disobeying the order will also face you with a steep fine in some places, such as our neighboring state of South Carolina, where violators could face a penalty of up to 30 days in prison or a $100 fine, according to USAtoday.com, Ortiz 2020. As we can see, disobeying the order will effectively increase the time at which we give up our normal lives and make people lose money. As stated before, we see that disobeying affects even those who are young and healthy. Now let's discuss the obvious. What will disobeying do to the elderly and the immunocompromised? Disobeying the stay-at-home order will increase the risk of death among elderly and immunocompromised. The virus directly affects elderly more than young. Movement of young, selfish individuals will increase the risk of an elderly person in their community getting the disease, according to CNN.com, Andrew 2020. According to CDC.gov 2020, 8 out of 10 deaths reported in the United States are those of individuals who are 65 years of age and older. Those who aren't staying home can be blamed for the continuance of the spread of this disease and thus the death of these elderly people. The virus also directly affects the sick and immunocompromised. Some examples of people who are immunocompromised are as followed, provided by the CDC.gov 2020. Those undergoing cancer treatment, smokers, bone marrow or organ transplantation, immune deficiencies, poorly controlled HIV or AIDS, people with heart conditions, the obese, people with asthma and liver disease, and prolonged use of immune-weakening medications. Disobeyers of the order can be blamed for the increased death of these people. My father is in fact going through cancer treatment as we speak, and it is my duty to his health and to his life to make sure I am constantly following the social distancing policies and the stay-at-home order. As we can see, disobeying the order not only affects us as young people, but affects the community around us, namely the immunocompromised and the elderly. Evidently, the COVID-19 pandemic not only affects those at higher risk, but also affects the young and healthy in many ways. Not staying at home can increase the time in which the order is in effect. It can make your economic situation worse by keeping you out of work, or by making you pay a steep fine if you do happen to disobey the order. Disobeying could also increase the risk of death of those who are immunocompromised or elderly. So I will leave you with this closing thought. Next time you decide to go to the park with your best friends, next time you decide to go to a bonfire with 8+ people, think of the bills that your family has to pay. Think of your grandparents, and think of my own father. Thank you.